and she be an information betoja. Now, some information on very sensitive. Just say NPP for na the time no information although a good hospitals near the adeno. Okowa emu say oh last week over na gale malaria ne na oba na asa onya cholera na ehu edru cry besi ibeden it be me say oh yema malaria plus cholera edru but ipa da se ni NPP ni ayeden afada this data yi and ho ano asochin on e ho ano asochin off me no na si kepi ewuru no a just a company me for the light waves omo no mo contract omo with a year sika pudru bi ano odin akwaye se wawa scandal Kesi a kwabla Mintah Akandoh about a parliament ayeden awabe Xpóses this NPP for just enya singuto sika hodo $100 million $77 million. How come say ubeti my project 100%? No, I move 50%. Wait, my 50% no more. There is $77 million a year. I know near 500 facilities out of 950 facilities. I was somewhere the mama light to is from there that a year. That company a year that facilities no. Now so 50% of that facilities no more use $77 million in the ISRD no. And no a year come Mintah Akandoh Babontin, Baba Xpóses this NPP Amanyukuni say afanya against the parliament Nangasangasan Waidin while lemon kashi because beginning no na was all camp at a near Koso liver hepatitis B then abani say but after saying Mintah Akandoh at the Ijamanski cancer no my honorable Kabiru Kampoede I did because no know this argument with the eba. Coming good in about nearly uncommented at us.
Drugs that are used to manage HIV are the same drugs that are used to manage hepatitis B. And I'm saying that the data available at Ghana Health Service point to the fact that we have more Ghanaians being infected by hepatitis B than HIV. So there's a public health situation. By the time the symptoms show, the person would have gotten to the advanced stage. Mr. Speaker, I have done an exercise in Winneba because when the data came out, it was so alarming, and a lot of those who were infected were saved by Safo Kantanka's drugs. He has some immune boosters, some liver boosters. And those who were on it, sometimes you go and test, and the viral load would have come.
That we have electronic collection of patients' data for the purposes of coordinating and informing evidence-based health policies. We are now back to that era. And that's the reason why I want the minister to rather take this issue more importantly now, because the members of parliament are here, the representatives of the people are here. And if he's going to organize press conference somewhere to address them, I'm not sure I'll be at the press conference, and I'm not sure how I'm going to tell the people of Wale Wale how the minister is addressing this issue. Mr. Speaker, the fact is that these people have not been paid their money. What measures is the minister putting in place to pay them their money so that they can bring back their service? Mr. Speaker, this is my question to him.
Thank you. Honorable Minister, he's saying this is the biggest platform you can have. So
Mr. Speaker, I agree. I will take up the challenge.
Yes.
So hear me. Mr. Speaker, in 2019, Ghana government signed an agreement with a company called Lightwave. Mr. Speaker, the contract sum was $100 million to connect 950 health facilities in the whole country. And the contract was supposed to expire in 2022. Mr. Speaker, in 2022, the contract was extended twice to expire on the 31st December 2024. Mr. Speaker, at the end of the 2024, out of the 950 facilities, only 450 had been connected. Out of the $100 million, $77 million had been paid. More than 77%. Meanwhile, less than 50% of the job had been done. Mr. Speaker, as part of the contract, it was supposed to be divided into what we call milestones. And so at the end of each milestone, the infrastructure and everything must be handed over to the state. Mr. Speaker, it is unconscionable for any government appointee to sign an electronic agreement that an individual will be hosting our data and the state will not have access to our data and the state will not have access to our service, our health data. Mr. Speaker, this is what we inherited. Mr. Speaker, at the end of the 2024 when we took office, in 2025, the contract had expired. And so the issue of the government has come to terminate any contract doesn't arise, Mr. Speaker, because the contract actually expired on 31st December 2024. So there was no issue of termination. Mr. Speaker, when we took office, as part of the contract, we said, hand over whatever you have done to the state. And before we sit to take delivery of whatever has been done, we needed as a ministry, as a government, to know whatever we were inheriting. As a forensic audit was conducted, Mr. Speaker. Mr. Speaker, as part of the forensic audit, what we realized was that the software, the hardware, the infrastructure alone, there were gaps. For example, it was stated in the agreement that supply HP laptops. You go to the facilities and a different brand has been supplied. Supply 20 and you go to the grounds and less than 20 has been supplied. So there were issues of quality and there were issues of quantity. Gaps. Mr. Speaker, the gaps alone, when analyzed, was over $18 million for the hardware. That was the gaps. Mr. Speaker, it will interest you to know that in the next milestone, Ghana government paid more than $10 million to the vendor. And he was supposed to connect about 157 facilities. Mr. Speaker, guess what? Only 7 was verified. 7. 1, 2, 3, 4, 5, 6, 7. Mr. Speaker, after all this, we said that, look, because we don't need any disruptions, we were ready to sign another agreement because there was no agreement, there was no contract. Because of the software, Mr. Speaker, it doesn't also make sense for the country's data, the software, to be owned by an individual. So we were ready. Let's sign a license renewal agreement for 2 years. Mr. Speaker, the vendor indicated that in the agreement, he doesn't want to hear anything about data. Yes. Mr. Speaker, the vendor again indicated that we should write as part of the contract that we, the ministry, have verified 461 instead of 450. Mr. Speaker, there and then, as ministry, we had to put our heads together to find solution to the matter than lamenting. Mr. Speaker, so, honorable members, the good news is that I've shared with you the challenges we have inherited, where the medical records, the electronic medical records, was being hosted by an individual, where the country didn't have access to our service. But at the moment, Mr. Speaker, we have the solution and we are rolling out in the whole country. We have a 4-week plan. In the first 1 week, next week, we are rolling more than 100 facilities. The third week, more than 100 facilities. And Mr. Speaker, I can assure you, with the shortest possible time, we'll get all these 450 facilities covered. Mr. Speaker, what this vendor was doing to the state was that as and when he demands what, then he will switch the thing off. And Mr. Speaker, for your information, the data, the server doesn't even sit in Ghana. It's far away in India. Yes, far away in India. Mr. Speaker, we are religiously guided by this contract and we'll put in place the necessary solutions so that we'll prevent the reoccurrence of the mess we have inherited. Mr. Speaker, tomorrow, as I've already indicated, We will give a full presentation on these issues, pictorial evidences, and we'll also tell the people of this country what we are going to roll out. I thank you for the opportunity.
Thank you very much. Name of Honorable Vincent Asefua Oltafo.
Thank you, Mr. Speaker. In accordance with Order 883 of our standing orders, I rise with authority from the Honorable Vincent Eko Asefua, Member of Parliament for Oltafo, to ask the Minister for Health the timeline for the completion of the maternity block at the Tafo Government Hospital. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Speaker. I wish to inform this August House that both executive and parliamentary approvals were duly secured for the financing and supply contract related to the Tafo Maternity Hospital project. Additionally, value for money negotiations were successfully concluded. However, Mr. Speaker, as you may recall, in January 2023, the government, through circular restructuring, I thank you, Mr. Speaker.
Very well. Yes, Honorable Gloria, any supplementary question?
Yes, please. Mr. Speaker, has the Ministry of Health engaged the Ministry of Finance to find a new funding or support to complete the Tafo maternity block and other health projects?
Yes, Honorable Minister.
Mr. Speaker, we are still pursuing the same source of funding, but it has to do with the debt restructuring. And so as and when we sign the bilateral agreements with them or conclude on the restructuring, we think that we've not hit the rock yet to be able to change course.
To a very lowest level, sometimes you cannot see it. It actually finds a way of getting out of your system, according to the data and the report from the health professionals. But, Mr. Speaker, because we do not have free treatment, people get it, they go test positive, and liver infection. Within 6 months, 8 months, a year, they lose it and they die. The better it will be for our population, especially when the mode of transmission is quite high. The way people get infected and all, it's not just one way. So it's a very important matter that our colleague Mavis has brought to the floor.
Thank you, Leader. So,
I didn't go to greet them.
Mr. Speaker, my information from the experts indicate that the sets of treatment to handle HIV is completely different from that which is used to handle hepatitis B. And therefore, the two cannot be the same, with the greatest of respect. And so, Mr. Speaker, if it is the humble opinion of the leader that we should rethink, we should relook at that which will handle hepatitis B, that's a different argument altogether. Maybe that one, we may decide to reflect on it. Thank you.
Very well. Yes, Leader.
Mr. Speaker, this period is not for debate, but once the minister put out some facts, it is important that a question is put for clarity. According to our respected colleague, the minister, he says that according to some experts, the treatment or the management of hepatitis B does not use, I use the word antiretroviral.
Honorable members, we don't need to split our hairs in this. He is on the floor. If you have a question, you can push. Don't worry. Let's allow him. Yes, Leader, please. Let's.
Mr. Speaker, Is the minister in his answer telling this House that the treatment of hepatitis B
Leader, please address me. Don't just address the chair.
is the minister saying that the treatment, as political leaders, people in our constituents are dying. And the time you realize it, your liver would have been gone. Vaccination is not for free. For adults, treatment is not for free. Meanwhile, it affects the population in higher numbers than the HIV that we fear. People are surviving more on HIV than hepatitis B.
It is due to the debt restructuring, so we are still pursuing the source of funding. Thank you.
Thank you very much. Yes, Honorable Gloria.
Mr. Speaker, what temporary steps has the ministry taken to reduce overcrowding, lack of staff shortage at the Tafo Government Hospital, where the maternity block remains suspended?
Yes, Honorable Minister.
Mr. Speaker, I thought we were talking about construction of maternity. We are now veering into the
Honorable
issues
members, please allow.
issues of recruitment of workers and what have you.
But he's talking about
Overcrowding.
Overcrowding, yes.
Mr. Speaker, what I can assure the honorable member is that we have a program for that facility, and we'll go according to what we have, the program we have. Thank you.
Thank you very much. Yes, Gloria, I'll give you last.
Mr. Speaker, please, I want to find out with the minister that how soon?
Yes, Honorable Minister.
Very soon.
Honorable members. Yes, Leader.
Mr. Speaker, with all due respect to the minister, I think the answer he has provided.
Abusha for Mintah Akandoh na Alpha this kind of expose we are to Chesenya some. So all these kind of things are cost during your time. Then so this government number power no more portray as if say this government the oma bomb on him the omo ade. Then so first in Ghana history 10 months or 9 months in power, he scandal being free a year this government. Then so more 3 months of scandal be peace. Then so for some ton abide with him at buying company or mobile money she any ade. Then so they for a health ministry or no. Come Mintah Akandoh about one thing. And this kind of expose we able to judge say and some ketokra. I expose these people no at the far a year $100 million a year dollars my company for the light wave. Saying come from them provide some 950 facilities B. Now so only half of the facilities been are complete. Now, so half on only $77 million now complete. The remaining half not the same be complete. So these people not buy some be discount gaza. And the SI say data at public hospitals now. You only say oh asemeti our bahano. You only say no yali we need a do see and a man. Na say do ne a more computer so. Nti mo doctors for say no man in time near do cry between the amount. So in case of emergency crampono, a bit may treat you as soon as possible. But Papa B, I ain't mean Bonnie Dean or as he say, because young confirming and free a year. Honorable Minister or catch say or China and or this a year press conference about to ja no Bobama 14, but we knew Akroma in charge of that, you know. I nana nam framema chese enya simkitwa. Owa na data no We're turning on between woman for a day due to sickness home in Roma JJ. I want to turn off. And my man for the air here on Monkwan. So parody also until on the Okaka Crampo. And this papa the way they were journey of the Ghana. And I want to turn it on, one not turning off. I'm a Mintah can ride a babu in Tiamba Xpóses a year papi. I just say any answer. No, you know, and a year Rebecca Niema air coso within or health ministry and NPP for especially for your market mom now sorry a year complaints about a drugs be also the ma or not me advertise before the free near the church name we break Casimir just say on one gas on more time on campo either way yes I no aqua casasa then so is and say a year more opponent in the only say you can't send from Guam fee sending by moon yan send behind the Envan can pay 2020 but no and I meet that can ride PowerPoint in the sending go see we are come more just any answer good one share no now for commenting and like it and subscribe my Akroma.